Cancer Guidance by Type, Part 39. Dr. Dilip Gadgil, Pune. Blood cancer. Leukemia is another type of blood cancer found in children. There are two primary types of leukemia. 1. AML, acute myeloid leukemia. 2. ALL, acute lymphocytic leukemia. Both types are equally bothersome. Under AML, there are 7 types, of which the first one is the most dangerous one and results in immediate death. Both types of cancer are treated using chemotherapy before the second line of chemotherapy is done. If that also doesn't work, then a bone marrow transplant is advised. In most cases, none of these treatment approaches work and death is very common in blood cancer cases. Unfortunately, leukemia affects children between the 5 to 6 or 17 to 25 age groups. It is very difficult to see young children dying from the disease at that age. Undergoing treatment can be very expensive and the success rate isn't great either. We had a case of a 5-year-old boy who was given chemotherapy and was fine after that. A year later, he came to me for treatment. His blast cell count was in the 68 to 70 range and could have gone into a state of blast crisis. He was okay for the next 6 months, when his blood cells count didn't increase or decrease. After 6 months, he had fever and pain in his knee before he died. This condition typically starts with fever for 3 to 4 days before blood tests are done. If the WBC number is found to be too high, a bone marrow biopsy and diagnosis is done. We had another patient who was 17 years of age. He had already undergone chemotherapy once before he came to us. But neither he nor his father seemed to be too serious about the treatment or diet. After 6 months, his cancer relapsed and he started bleeding profusely from everywhere. Nasal bleeding is common in such cases, but in his case, he was bleeding from his nose, ears, eyes, mouth, and anus. He was admitted to a hospital, but he died a few days later. Since there are no visible symptoms in the recovery period, people assume that everything is fine. However, this isn't correct. In another patient's case, he underwent chemotherapy twice before a bone marrow transplant was done. His blast cell count went down to 0. He had jaundice, which started becoming problematic and couldn't be controlled.